So Dreamsickle Kids Foundation is the first sickle cell disease nonprofit in Nevada. Our focus is to raise awareness for sickle cell disease, which primarily affects people of African American descent. So we advocate for long-term changes for patients with sickle cell disease in Nevada to try and improve the health equity for people with sickle cell disease and those with rare diseases in Nevada. So we serve the patient population here by raising awareness, speaking with professionals, legislators to try to bring about long-term change for the people in Nevada with sickle cell disease. In 2015, I gave birth to a daughter and she has sickle cell disease. We lived in California, and part of our move was because just in my research in regards to how sickle cell disease affects people, I felt that economically it would be better for us to move someplace that was more affordable. So we came to Nevada, and in moving to Nevada, we found that there weren't many resources available for people with sickle cell disease. So for about the first year or so, we would travel back to California for any of her checkups. And then she finally had a crisis, and the hospital that we visited here didn't have much knowledge of her condition. And so they sent her away with just some Tylenol and said that it wasn't a big deal. And 2 days later, we found out that she had pneumonia in both her lungs, and she was admitted to ICU at another hospital about 40 minutes away. And at that time, I decided that it was time for us to make Nevada aware of sickle cell disease and make sure that the resources were available for not just the patients, but for the families and the caregivers that are taking care of these people with this rare disease. So initially, after my experience at the hospital, because we had a brand new hospital that was about 5 minutes from where we lived, and that's the hospital that couldn't really treat her adequately. So I began to send emails to the hospital to let them know about this experience that I had. And I didn't get a response back. So I began to do my research to find out who our assembly person was in our district. And I contacted her and I sent her an email in regards to the situation. And she was able to reach out to that hospital and say, hey, my constituent has these, serious concerns about the treatment of her child at this hospital. And through that, she was able to get us connected with the hospital's chief medical officer and their patient advocate, who I was able to meet with. And when I explained my situation, it turned out that the chief medical officer was African, and his son actually was in college and also had sickle cell disease. So he said that a part of his goal for the hospital was to make sure that all of his ER physicians were knowledgeable about, at minimum, the basics of how to treat a patient that presents in the ER with sickle cell disease. And from that point on, we developed a great relationship, and they support, everything that Dreamsickle does when it comes to raising awareness for sickle cell. And in 2019, one of our assembly women here, she's now a senator, Gina Glass, she sponsored the first sickle cell bill of the state, which passed June of 2019. And this hospital, Dignity Health, they wrote letters of support to help with getting that bill passed.